Hey there, this is Alex. Today I'm going to be performing the PASS for our adult neuro rehab class. So, start out, we would choose the PASS. It is a postural and balance assessment that is a little bit easier than the Berg balance scale, but it's also going to allow us to look at affected versus unaffected side. It's also going to be really good to do in populations like 0 to 3 months post-stroke, so really that inpatient kind of setting, very acute. It's just going to give us a good look at their balance, postural control. So we'll get started. It's going to be 12 different items scored 0 to 3, 3 being the max score, 0 being the lowest score. So the first score, first I should say, we need to make sure our patient is safe, has a gait belt on. If we're going to do any standing or moving around, we need to make sure they have good shoes or socks with the rubber on the bottom, something that they're steady and they're not going to slip and slide around. All right, so patient safe, has gait belt, shoes, nice and stable. Got it to where the feet are touching the ground nice. So the first item is going to be sitting without support. So got my hand back here, but I'm not touching. I'm guarding the hemiparetic side that would be most affected. That way if they lean this way, I can catch them. But we're just gonna try to have them sit here for 5 minutes. That's gonna be a max score. Next is going to be standing with support. So can you go ahead and stand for me? All right, so I'd be guarding, watching. They're allowed to assist of an assistive device that they can use, or if we had another person that could help, they could give them, a hand to brace against, something of that nature. But the idea is to not give them any support, just to be guarding and standing. You want them to be able to do that for 1 minute. Okay, then the next would be standing without support. So we would take away support, and we would be guarding and seeing if they could stand for 1 minute again. But with standing without support, we want to have them moving their upper extremities as well, about shoulder level. So I'd ask, can you bring your arms up to in front of you? Can you give me some arm circles? Bring them out to the side. Okay, things of that nature. So if he can do that, the max score, it would be a 3. Next is going to be standing on the non-paretic leg. So I would have them do a weight shift over towards the non-paretic side. Again, guarding, making sure that we're okay. Want them to be able to do this for 10 seconds or more. It's going to be a max score. Then you can come back to standing. Next item would be standing on the paretic leg. So you would have them shift. This one would be the more or less safe one, so we want to really make sure we're guarding because this is the weaker leg. Again, 10 seconds or more is what we're looking for on this leg. The next one, you can go ahead and sit for me. In fact, we'll go ahead and lie down. So we'll remove shoes, keep the table nice. Just get them in position. Okay, so from a supine position, what we're going to look at is going to be supine to rotating to the paretic side. So ideally they would have more room than on this table, but I'm going to have Zach roll towards me. And if he needs any help at all, then it's going to be a score less than 3. But if he can do it by himself, it's going to be a 3. So Zach, can you roll towards me up onto your side? So I'm guarding to make sure they're safe on this side of the table. Go ahead and go back to your back for me. Good. Then we complete to the other side. Supine to sideline on the non-paretic side. So can you roll towards me? And again, if I had to give any assist at the shoulder blades or at the hip or anywhere else, go ahead and lay back down for me. Then that would be less than a 3. Okay. Next is going to be supine to sitting at the edge of the bed. So what I would do is guard the patient, make sure everything is clear here, and I would ask Zach, what I want you to do is sit up onto the edge of the bed, okay? All right, so go ahead for me. So I'd be guarding if they need assistance, right? Making sure they're not gonna fall to either side, because again, that's his more affected side. Ideally, you might even have another person on the other side of the bed just to make sure it's safe, whatever else, but we wanna be able to give them that assistance sitting up if they need to. But if they can do it by themselves, it's a 3. Next is going to be sitting on the edge of bed to supine. So we go back down. So Zach, can you lay back down for me? Again, making sure they're safe. If they need assistance at the legs, whatever else we can apply. If they need no assistance, that's a 3. Next is going to be sitting to standing. So you have the patient sit up again. Zach, can you sit up for me, please? Thank you. Make sure they're on the edge of bed. Ideally, again, we'd have their shoes on. In this case, I think we'll be okay without them, but just noting shoes, proper footwear, so they're not going to slide around. Zach, I'm going to ask you to stand up for me, okay? So go ahead and stand. ideally blocking the affected leg. That way if they need that support, they have it. And then the next test is going from standing to sitting. You sit down for me? Good. So, again, if they can do either of these by themselves, max score of 3. If they need a little help, it's a 2. More help, it's a 1. If they can't perform it, it's a 0. And the last one is going to be standing to picking up a pencil on the floor. So Zach, can you stand up for me? Good. For just a moment, I'm going to get my pencil here. But we wouldn't leave the patient standing by themselves. That's a no-no. Okay, so pencil on the floor. So let's say, all right, so nice and easy. I want you to bend over and pick up this pencil from the ground for me, okay? Good. Following them. They have the bed behind them as support if they need it. We're on their paretic side, blocking if we need to, making sure that they're safe. So that is going to be the 12 items of the pass. Again, looking at postural control and balance.